Hello, I'm here with CORROSOURCE Medical Director Dr. Patrick Cody. We want to take this moment to thank all first responders during this National EMS Week.
Absolutely. It's very important to us that we have the opportunity to recognize all of the EMS professionals that we work with on a daily basis.
I want you to stick around. We're going to sit down and talk about some trends happening in emergency medicine, and we're going to talk about how WellSite Century is transforming WellSite safety with our medical emergency technicians out on the site. All right, so Dr. Cody, thank you for taking the time to sit down and discuss with us some of the trends that's happening in emergency medicine. If there's anyone that knows what is happening in emergency medicine, it would be you. As I go around the state talking to different guys, they all say, I know Dr. Cody. Yeah, he's, I've worked with him at this training or that training, so I know you're well known around the state and really the nation in emergency medicine. So maybe just give us a little background about yourself and your passion for what you're doing.
So I started out as a music major, actually.
Okay.
My degree's in music, but then, I always wanted to go to medical school, so I got a job working as a nurse's aide in the ER. And I did that to try to figure out, really if I wanted to go into medicine. And what I figured out while I was there was that in the emergency room, the people who work in there are kind of the jack of all trades, right? They know a little bit about everything. They're the first 1 to 2 hours of everybody else's specialty, which makes it for a really interesting, sometimes exciting day. So when I went to medical school, I tried to keep an open mind. I said, well, maybe I want to be a pediatrician, maybe I want to be an obstetrician, maybe I want to be a surgeon. But I could never find anything that just fulfilled me the way emergency medicine does. And so I ended up, after medical school, doing a residency in emergency medicine. Then I did a fellowship in pre-hospital and disaster medicine. And then came to Norman to practice and have been here ever since.
Yeah. Now you're involved in several things with your emergency medicine. Can you kind of tell us what you're doing and some of the things you do?
So a lot of ER doctors, kind of like some of our first responders, have side hustles. And so my side hustle is that I do a lot of EMS medical direction for transport services and also for fire departments that do first response. And then now we have this relationship through CORROSOURCE. And so that's one of my big things. And then the other thing that I really love is adult education. And so we've opened a residency program at my primary place, and we train resident doctors. We have a 4-year program. They come in as fresh graduates from medical school, and then we kind of raise them, and it's sort of like being a plumber's apprentice or something along those lines. And when they graduate, they're full-fledged bona fide ER doctors.
Wow, that's great. So you're also a member of the SWAT team?
Yeah, I'm the team doc for the Norman SWAT team.
All right, excellent. I'm sure you get some exciting stuff on that.
Yeah, sometimes it's pretty exciting. Really I consider my job with them to be team health, battle readiness, that kind of thing. So I'm not one of those guys who puts on the gear and goes and knocks down doors, but I really admire those who do.
Yeah, but that's great having the doctor right there on site in emergency incidents or standby on that, so that's great. Well, emergency medicine is a field that a lot of people don't really think about until they actually need it, until they call 911. Can you maybe kind of explain to us what are a couple of major shifts, if any, or trends happening in emergency medicine that you see happening?
Absolutely. There are a few things going on in our field. One is we're seeing a trend where the patients in the emergency room are actually sicker, in my opinion, than they once were. And I think the reason for that is urgent cares have popped up all around, and so they tend to siphon off those patients who are less sick and leave us the patients who are a little bit sicker in the emergency room. So I think our acuity has gone up over the years, which is really interesting.
Would you see that as a positive trend?
I think for somebody who enjoys taking care of sick people, I think it's positive because it helps keep our skills up and things like that. I don't know that it's necessarily negative, but in the places where I work, we used to have fast tracks to handle the less urgent patients. Because that volume has gone down so much, we don't really have fast tracks anymore because those patients are really going someplace else to get their health care.
You see a lot of these urgent cares popping up and do great service, but that's interesting.
Trend. It's been interesting for the business of emergency medicine. The other thing we're seeing is that there's a shortage of trained ER doctors. So there aren't enough ER docs for all of the ERs around. And one of the things that has sort of shifted in our paradigm is we now use a lot of advanced practice clinicians. So those are the physician assistants, the nurse practitioners, and they work side by side with us in the emergency department, taking care of patients that are probably a lot sicker than the patients that maybe they would have once cared for in the emergency room.
Sure.
And I think that's actually been a pretty positive trend on both sides. I think it's nice for the APCs because it gives them, additional workforce capabilities, and it's positive for us because we get to build those relationships, and also gives us the opportunity for some education and that kind of thing. The other thing we're seeing a lot of is we're seeing this sort of increase of telehealth creep into the emergency room. We're seeing that in a couple of different ways. One of those is that in the smaller emergency departments, there are certain things that are considered to be time-sensitive medical emergencies, and sometimes the providers may need to do a little consultation with a specialist who's in a bigger community. And particularly for something like stroke care, those consultants want to see the patient because sometimes we're doing interventions on these patients that can actually have quite a bit of risk associated with them. And so before the neurologist says, yeah, I want you to do this or I want you to do that, they want to see those patients. So using technology similar to our iPad, you can go in there and you can literally hook the patient up to the consultant, and the patient can be in, Broken Toe, Oklahoma, and the consultant's in Oklahoma City, and they're communicating, and that physician is examining the patient, miles and miles away through telehealth.
Yeah.
Some hospitals are using that same technology. When they admit a patient, the hospitalist will be doing telehealth kind of work in concert with the nurses there on site. And then, I was thinking about this as we were kind of preparing to talk this morning. If you think about it, did you ever see that show, Emergency, with Johnny and Roy and Squad 51?
Yes.
Even those guys were using a little bit of telehealth. Yeah, they had some of that vision because they would transmit telemetry and stuff like that. And so one of the things we do is when our medics go and they see somebody who they think is having a STEMI heart attack, they'll send us an EKG over telemetry. We'll receive that. It'll print off, we'll look at it, and we can actually activate the cath lab while the medics and the patient are still 15 minutes away. And so really that's a form of telehealth that we're using every day in our emergency department.
Right. I find that very interesting. It comes down to communication.
Absolutely.
From the field to the ER. And if that communication wasn't there, that person's the risk goes up.
Right.
And so your telehealth is a huge thing, and that you brought it up. That's a big part of some of the value that we're trying to bring out there on the field with our command units. Is, as you all know, we have the triage facility. It's a clean space where someone that's injured or sick out on the well site can come into our command units and be evaluated by our EMTs. Maybe explain kind of that relationship, that EMT with that patient, if you will, out
Absolutely.
in the field, our role as CORROSOURCE operating under the EMTB protocols right now.
Absolutely. So, the EMT in the field has 2 or 3 roles. As I kind of alluded to before, I think one of the roles is health, wellness, and in this case, job readiness, right? Keeping people healthy so they can perform their work tasks and do so safely. Then following protocols, there are certain things that the EMT can do to take care of folks if they present for care. But there will be times when the EMT may say, I need some expert consultation about this patient. Something's not right here, or this is a little above my training and scope. And so through telehealth, the technology is such now that literally you can place a stethoscope on a patient's chest, and the recipient on the other end of the line can hear the heart tones wherever they are. You can use an otoscope to shine lights in their eyes, their ears, their mouth. You can see that wherever you are. You can transmit EKG telemetry. You can do all those things, and it doesn't matter where the end recipient is. And so if you have somebody who knows how to obtain that information and can transmit it and communicate with somebody on the other end, then essentially that EMT is now a physician extender. Because they have the ability to gather that information and really get a real-time consultation with somebody with a higher level of licensure.
Yeah, that's some pretty cool stuff, and that's some of the stuff we're looking at, that technology to apply here at CORROSOURCE so that our EMTs can be those hands of those physicians out in the field. Currently, a lot of our customers already have telehealth providers in place, and so we've had instances where we've had patients connect with their telehealth provider, and our EMT is there in the command trailer able to provide more information. Because I guess from what I've seen with telehealth is you call in a nurse or doctor, and as the patient, my arm hurts, my chest hurts, and that's about all you can tell them.
Right.
And they can ask some, simple physiological questions that what's happening with you, but to have an EMT right beside you,
Yes.
telling them heart rate, telling them ox, telling them what they're observing from the patient. I mean, that's a different ballgame for that doctor or nurse making a decision.
Absolutely. The more information you have, if you're the doctor, the nurse, the person making the decision, the more information you have, the more data points you have, the better decision you can make. It's really that simple.
Yeah. Well, we're excited about some of the things that are coming with telehealth and CORROSOURCE in the near future. You know, we're really privileged just to have you as a partner here at CORROSOURCE as our
Thank
medical
you.
director. And I know this was a little bit different when I first addressed you about what we were doing, but you caught the vision and you've been supporting that, and I want to say thank you. Yeah, anything to add or
Well,
with you?
sure. First of all, I appreciate the sentiment. It's a pleasure to be working with you. You know, as we're having this conversation during EMS week, you know, I would like to just conclude by saying, you know, I have great respect for all the EMS professionals that I work with every day. As an ER doctor, having quality EMS professionals makes my job so much easier, and I have lost count of the number of times I hear about people's lives absolutely being touched and saved because of quality EMS providers, and we're really blessed to have that with us in this state. So thank you.
Yes, and I would like to echo that response and just say thank you for your service as a former first responder. We know sometimes those shifts aren't easy and they get very difficult. First and foremost, take care of yourself after those shifts. Debrief, do what you need to. And we thank you for what you do for our communities every day.